After childbirth session here at Inova Women's Services. Today's session is a special session, a couple session that we're calling Pelvic Floor and Emotional Changes After Childbirth, Sexual Expectations for New Parents. And we hope that with this small group that we have today, that we'll get to addressing any specific questions that you all have after we do our presentation. And our presentation will consist of two of our experts. We have Dr. Abbas Shobeiri, who is a national and international renowned urogynecologist, who is going to start us off and do his session on the pelvic floor changes that occur after childbirth. And then we'll be followed up with Rachel Noble, who is the Director of Women's Behavioral Health here at Inova. And Rachel is a therapist and an author. She writes a lot of articles on behavioral health and serves as an expert as well in her field. So I know we have quite a bit to get through in the presentation. I'm going to let Dr. Shobeiri begin. He is going, oh, well, actually, I do have a poll. So Dr. Shobeiri, you just let me know when you would like me to do that. And I'll let you take it away.
Okay, should I screen share and then you do the poll?
Sounds good.
When we get to the slide, okay. So you can see my screen. And let me see, okay, very good. So we are talking about pelvic floor and emotional changes after childbirth. This is an area that we are very passionate about, as many of our new parents really don't know what to expect. So we are going to talk about resources, where to seek help, pelvic floor anatomy, strategies, and really then I would just turn it over to Rachel to talk about the psychological aspects of the issue. So go ahead and get the poll going. So this poll is just going to ask you some questions so we know what we are starting with and what your background is. So if you don't mind, just take your time for a minute or two and complete this poll.
And this is just for the mothers.
Okay, some answers are coming in, so that's good.
And your poll is completely anonymous. We don't know who's answering this.
Mm-hmm.
Oh, I'm sorry. Somebody's having trouble. They can't complete the poll, but they're currently pregnant, 36 to 42. Okay, thank you. Is anybody else having trouble completing it?
So we have a few people that don't seem to have the ability to complete the poll, but they're pregnant. Okay, very good. So should we end the polling and we can start? Okay, so basically I'm going to just share the results with you. You can see that there is a good spread. Some people are older. Most have delivered within the past 6 months of those who have delivered, and nobody had a third or fourth degree lacerations. Um, with the baby, there is exhaustion, feeling overwhelmed, lack of sexual desire, and happiness. So, and then, um, and then this is, um, you can click many of these: emotionally exhausted, depressed, lack of sexual desire, and then also some are happy. So that's good. We know where we are starting. And I'm just going to go back to my slides. Okay. So the good news, bad news, there are some resources, but none of them are really good resources for what we are talking about, which is exactly why we are talking about this. There are national organizations that deal with pelvic health and women's health, but really nothing about what we are talking about that I know of. American Urogyne Society talks in generalities about pelvic floor disorders, and there is a high interest in about what we are talking about, but really there is nothing per se for the patient to take advantage of. So talking about sex after childbirth, postpartum period, which is right after you have delivered your baby, the sexual function is influenced by many significant changes in your anatomy, hormonal changes, your family structure changes, your partner relationships have changed as well. So all of these affect your sexual activity. Anatomically, trauma to the perineal area causes intercourse to be painful. And this also affects the timing and quality of sexual activity that you may have. Breastfeeding, which is what we encourage because of many beneficial effects that it has, also alters sexual function because it causes vaginal dryness. And also this just would affect sexual activity. Things are not the way that they used to be. Family structure, changing sleep patterns decreases the likelihood of you and your partner having the time or the privacy to reestablish intimacy. Some of our patients, they have cultural taboos and societal dictates about when they can start having intercourse. Postpartum depression that may accompany postpartum period can be taken care of with the antidepressants, but then the antidepressants themselves, depending on the kind they are, may contribute to postpartum sexual dysfunction. So talking about anatomy, your pelvic floor is a very, very complex structure. It's, imagine your diaphragm that you use to breathe. You have the same thing in your bottom, except that now instead of the esophagus and the stomach, now you have these other tubes that bring urine out, and the vagina and the rectum. And the muscles that you see here are supposed to regulate your urination, your bowel movements, your sexual activity. These muscles are constantly in tension. With pregnancy, they sort of loosen, and then during childbirth, they undergo some more changes that may cause them to either be lax or it may cause them to be in a spasm. And we are going to go over these muscles. Talking about your pelvic floor function, just genetically, your pelvic floor is designed to sort of have an end of life expiration date. Some of you, your pelvic floor is designed to go on into your 80s and 90s and you won't have any problems. But some of you genetically, you would be in this curve that hits the bottom sooner rather than later. And then the other thing to talk about, there are things that would affect that curve that you're going through. So genetically, you may have been destined to have decline of your pelvic floor function in your 80s, but say you have uh, an event such as traumatic childbirth that decreases your pelvic floor function. So instead of having decline at age 80, now you're declining at age 50. And then also your lifestyle choices or lifestyle impact, obesity, smoking, things that cause you cough a lot, constipation, will increase the curve where you would fail sooner rather than later, as we talked about. So you can see here, the curve has been pushed up. Okay. Your pelvic floor, as I said, is supporting all these organs that are coming through, and it's supposed to carry the load. Just by standing up, you're carrying about 40 newtons of force, which means that it is as if you have a bag with 40 apples in your pelvis. Remember Newton, one apple fell on his head. So 40 newtons is equivalent to 40 apples. When you get pregnant, that pressure will come down on your pelvis. So there would be even more force coming down, and then the muscles would relax because of the hormones. And then with the labor contractions, that force will even go further. And when you push the baby out, you go up to 130 Newton of force, which can cause damage to your muscles. So as the baby is coming through, the muscles are stretched, and then some of those organs we talked about, they would be exposed to these forces that we talked about. And after the baby has delivered, the muscles should go back to normal. Now, some of the events that may occur during childbirth is that you may have uh, some lacerations that you can see here. So you can have first or second degree laceration, which means that you have lacerations going to just to the skin, which can happen frequently. But the ones that we try to avoid are these ones that I'm circling in pink here, where you have laceration to the anal sphincter muscle. And the anal sphincter muscle is this structure that you see here in blue, goes around the anus, prevents seepage of stool, and etc. These structures that I have put in here just gives you some respect for your perineum that you were unaware of by now. There are a tremendous number of muscles and structures that come together at the perineum. So when there is a laceration in this area, all of these muscles can get disrupted. So you have many muscles that create your perineum, they would get disrupted, and then sometimes repairing them during childbirth may not be easy because of just edema and swelling and so forth. You know, there's a reason that this is, like in the Eastern philosophy, this is one of your chakras because of all the tension that is holding. Other muscles that we worry about are your levator ani muscles or deep pelvic floor muscles that have to get a stretch to let the baby through. And then you can see these muscles are very complex as well, and they can have injury to them as the baby is coming through. And as these muscles lax, then your sexual function, your urination, defecation suffers. Research that we did that hasn't been published has shown that people who have actually stronger pelvic floor muscles have better sexual function. Conversely, people who are elite athletes and haven't relaxed these muscles during childbirth have higher incidence of injury to these muscles. So it's a two-edged sword. You can be an elite athlete, but you need to massage and relax your muscles before childbirth. So going through, these are your risk factors that can expose you to having levator anal injury, pelvic floor injury, and mainly involves big babies, pushing too rapidly, or your second stage of labor lasting for too long, or if there is a baby stuck and they have to use forceps in emergency basis to get a baby out. So your deep muscles, your levator ani muscles, there's no way to see them visually, or the only way that we evaluate them is by ultrasound. You come to my clinic, I ultrasound you, and I tell you how your muscles are. But the tip-offs are if you can't pee, if you have pain, if your scars are not healing, if there is a seepage of stool and urine, if your bladder and uterus are descending, or if the forceps we're using in emergencies, you have higher risk of injury. And then really, after all this has gone on and the baby has come through the pelvic floor area, how should your brain even tell you to have sex? This is something that you are dealing with. We have a clinic really dedicated to postpartum pregnancy conditions, and there is a phone number there in case you need to see us. Talking about sex and after pregnancy issues, as I said, the estrogen is low, you are breastfeeding, your vaginal skin is very thin. It has gone from basically being this thick here to becoming thin, and then it's not producing the lubricants that you are used to, and the vaginal intercourse becomes just very tender and unpleasant. Sometimes because of the injuries and issues that are going on, your pelvic floor muscles go into spasm. They tighten up just like your neck muscles. And we use a lot of physical therapy, pelvic floor therapy, to deal with this condition as well. And one of the things that can happen if a person tries to have intercourse too early and it's painful, the next time they see their partners, the muscles just instinctively tighten up and then becomes a chronic condition. So don't do anything that is not pleasant for you. So when we talk about sexual function, it's disorders of desire, arousal, orgasm, and pain. It's very common in women. 43% of women just have general lack of desire. But when you break that down, you can see that really only about 12% of them have orgasmic disorder where they cannot have orgasm. And then about 27% of this happens in reproductive age women. Postpartum dysfunction is more frequent because in about 83% of women, they do have this problem. They're just coming through childbirth and it's difficult for them to concentrate on sex. Sadly, only 18% of women receive information about their sexual function after childbirth, even though about 70% are literally begging for the information, and they're not getting all the information that they should. So despite all the factors that are going on, the resumption of sexual activity postpartum is quite rapid. About 52% of women resume sexual activity by about 6 weeks after delivering their baby. And by about 3 months, 90% of them have resumed sexual activity. A predictor of the sexual activity is that if you were not sexually active at 12 weeks, then you probably would not be sexually active at 3 to 6 months after delivering baby. And a lot of that has to do with your beliefs and just why you feel that's not the right thing to do. About 55% of women do experience pain after childbirth during intercourse, and 45% of them would have decreased pain. As the time elapses, you will have less and less pain. Breastfeeding itself increases your risk of pain with intercourse by about 4 to 5-fold. And then sexual function dysfunction is common in women who have depression. And then 40% of depressed women report that they don't have the desire and arousal or orgasm capacity. So again, we do have the clinic. At this point, I'm going to turn it over to Rachel. Rachel, do you want me to stop sharing so you can share your own slides?
Yes, please.
Okay, so I'm going to.
Wait, not yet. Actually, let me just, give me 1 second. Yes is the short answer.
Yes.
Yes. Well, wait, no, wait. It's my computer for some reason is not opening it up as fast as I want. So I might want you to.
I'll be your
You might need to be
progressor.
my progressor. So I can't see me. Can you guys see me?
I can see you, but
Hold on, let me see if I can't see you, Rachel, but let me see if I can change the spotlight.
well, actually, let me see. Do you see her now, Sue?
No.
I put her on.
I don't either.
Okay, I spotlighted her.
Oh, cool.
There I am. All right. Okay, good.
How come she gets a spotlighted and I don't know?
You got your spotlight.
Oh, good.
Okay. You
So,
got your
Rachel,
spotlight.
can you share or should I share?
It's PowerPoint is opening it up now. So give it 1 more second and make sure it actually opens. And as it's opening, I'll just do my introduction while it's thinking, and then I'll let you know when to let it go. So I am Rachel Noble, and this is me. I am, most important thing to say about my job, because I know I have a long title, is that I am a therapist, and I do still see patients, and I work with, couples and individuals, women that are in this period and other periods in their life. And we have a lot of conversations about exactly what Dr. Shobeiri talked about, as well as other things around intimacy, right? And how to talk about intimacy and how to understand intimacy within yourself and how to communicate it effectively with your partner. My specialties do include, obviously, women's health, chronic pain, and chronic medical concerns. I actually work with a lot of women that have pelvic floor disorders because of this reason, childbirth or other reasons, and then resilience and burnout. And as Sue mentioned, I do write on issues regarding mental health concerns. So yes, I can now, I have my presentation up. So if you want to stop sharing, Dr. Shobeiri, and then I will start sharing, and then we will see how it goes. Okay, share my screen.
And Rachel, I have a 1-question poll for you if you want me to put that up.
Sure, go ahead.
Okay. This is for everybody, not just the ladies this time.
All right, and then let me do this. All right, can you guys see my presentation?
Yes.
Yes, yay. Okay, I did it right.
Okay, we've got people answering the poll.
Okay.
I think you're gonna like what you see there, Rachel.
Well, right now I'm seeing my slides. You'll have to.
Oh, okay. All right, let's see. I've got, let's see if anybody else is gonna answer. Maybe not. All right, so I'm gonna end the polling here. Okay.
So what did it say? Oh, there it goes. Okay. Where 1 is definitely not, and 5 is we talk all the time. Good. Okay. Yay. Okay. People are at least talking some. That's good. Instead of, definitely not. That's good. Because I have to say, I was a little concerned because when we did the first poll and we asked about, do you feel more emotionally connected after this? I didn't notice anyone answer that one. So I'm glad to see that people are feeling like they can talk, because that is key to maintaining both physical and emotional intimacy, right? So let me get going on my presentation, and then we'll have time at the end for questions, because I'm guessing you guys have questions, because every time I hear Dr. Shobeiri talk, I have questions. So let me get going. So when we're talking about intimacy, to me, especially as a therapist, these are very intertwined. Emotional intimacy and physical intimacy, you can't take them apart. And the objectives tonight is we're going to talk about the 4 pillars of intimacy: knowing, liking, trusting, and communicating. We're going to discuss how to effectively communicate. We're going to talk about what self-care looks like and when you need to seek help. So it goes without saying that becoming a parent and going through childbirth, just talking about the anatomy of what you go through, this is a massive shift. This is a huge change in your physical self and in your identity, and then your emotional self. So you go through, again, both physical and emotional changes. And it's more important than ever to effectively to listen to your body, listen to yourself, learn how to advocate for yourself, but then also effectively communicate with your partner. It's critical right now, because you guys are going to need to do a good job of co-parenting, which is such a challenge to figure out, maintaining couplehood, and keeping any sense of individual self. This is a delicate balancing act, and you need to be able to effectively communicate to do that. So let's look at those 4 pillars of intimacy. You really need to know yourself and know your partner. I think that the diagrams that Dr. Shobeiri went through helped us get a much better understanding of how to know our physical selves with the perineum, but there's other parts too, right? So it's important to know before sex, or before the baby and after the baby, yourself, your body, your personhood, and to like yourself. And you'd be surprised how many times I say to someone, do you like yourself? And some people are okay with that question, and some people really struggle with it. So it's important to like yourself, even just a little bit, to have good trust yourself, and communication. So again, intimacy with yourself. You need to know and understand who you are, so you can then help others know and understand who you are and where you are. We discover ourselves really in our relationships with others, not off by ourselves. It's interesting. Sometimes people will get this thing in their head, or I'm going to go find myself. I'm going to, drive to Montana or something like that. And that's really not where we find ourselves. We figure out who we are and what our boundaries are and what our likes and dislikes are, usually in our relationships with others. It helps us figure out our borders, our boundaries, our needs, and really what brings us joy. So again, when you're getting to know yourself, you're going to really need to know, we're talking about physically, what's your body like, and what are your uniquenesses? What brings you to an orgasm historically and then now? And even if we're not talking about orgasm, what have you liked historically and now? Symptoms, are there any pain triggers or any other types of exacerbations? And if so, can you talk about them? Do you have a history of mood instability? If you ever struggled in the past with anxiety or depression, or even just kind of high irritability, you wouldn't be surprised to see it exacerbated during this time, either during pregnancy or after. Do you recognize that you deserve to be loved? And that one, again, sometimes is quite a loaded question, but it's certainly worth considering. And what makes you happy? And what are your boundaries? What are you comfortable with and what are you not, both physically and emotionally? So we're going to take just questions to think about when we're talking about liking yourself. If that feels like too big a question, we can break it down to, what do you do well? And what do others like about you? Sometimes I'll ask this question of people and they really struggle with it. And I'll be like, okay, well, tell me what other people around you say they like about you. And then what are you proud of, both physically and emotionally? And trust. Do you trust your judgment? This is a big one, especially when you are trying to advocate for yourself, because it's sometimes hard to explain. Dr. Shobeiri is such an incredible doctor, and he does such a great job of understanding the challenges that women go through during childbirth. But not all doctors hear it quite as well. And sometimes it's important to be able to advocate for yourself. Do you trust your decisions? Do you trust your intent? Intent is an important part of it. It's not just what you do, but why you do it. Do you trust your body? A lot of people really struggle with this time after they've delivered, and they feel like if things don't just bounce right back and pop right back, or if they had trouble conceiving or trouble afterwards, they really don't trust their body. They feel like their body has failed them. And there's almost like this frustration with themselves, or even this grief or loss, or feeling of not just being able to trust their parts and pieces. And how, if you struggle with any of these things, how do you keep yourself safe? Again, both emotionally and physically. And trauma, this is a conversation that comes up often in this world. A lot of women will describe what they experienced when they delivered as a traumatic experience, but a lot of healthcare providers won't necessarily see it that way because they have different definitions of what this looks like. And so again, sometimes it makes it harder for women to advocate for themselves when it comes to this. But a nice broad definition of trauma is if you feel like you had a loss of control, or a situation of powerlessness or hopelessness. And this is either for you or your partner. It's interesting. I'll talk to partners often that will describe witnessing the childbirth or what was going on as traumatic for them because they really felt helpless, especially if there was a struggle or a problem and they felt like they couldn't do anything. And this can become a problem. It can become a barrier. So you really need to, again, engage in very open communication. So for example, do you have honest conversations even with yourself? And some people are good at this and some people aren't. Do you listen to your body when it's trying to tell you something? Do you say what you need to say? Some people really struggle with this. Do you know how to say no? Healthy boundaries are just that. They're quite healthy. And do you know how to say what you feel in addition to stating the facts? I find that when couples are trying to communicate, there'll be a disconnect in the communication, and it's not because they're not stating the facts, it's because they're not then saying, and so when I hear you say that, this is how that makes me feel. And do you, when you're trying to communicate, do you listen? Do you really listen? Or do you just wait to talk? And we all know those people that don't really hear us. They're just waiting for us to stop talking so they can start talking. So it's important to remember this nice old phrase that says you have to listen to be heard. And changes, obviously, the bodies, people's needs, they all change over time, especially with childbirth. And there's a consistent need to assess these changes and what those parameters then look like around knowing yourself, liking yourself, trusting and communicating, and to keep your relationship with yourself and others changing along with those changes with your body. Because especially with those 4 pillars, they get knocked around a lot by childbirth and pregnancy. Intimacy with others. So that's intimacy with yourself, but with others also. It's very important. This time can often be a stressor on couples because their norms get knocked out of the way by the pregnancy and by this time after childbirth. So it's important to know your partners both physically and emotionally, and to really like your partner and trust them and communicate well with them. What are their likes and dislikes? What are their strengths and their struggles? And how do you know how to make them smile? Can you complement their strengths? And know how do you show your love for them, and then vice versa. Trust your partner. Do you believe your partner? Do you believe what they say is true? Do you believe they have your best interest in mind? And do you have their best interest in mind? Do they have good judgment regarding themselves and you? And remember, trust is a very simple formula. Trust equals consistency over time. So however somebody behaves consistently over time, you can trust that's what they're going to do, unless there's a need for a shift. And again, when there's a need for a shift, it's important to remember there's this nice old phrase that says, the truth hurts, but silence kills. And that's really true. That's true in big overt ways, like ignoring cancer symptoms, or in a million little ways, like ignoring problems in a relationship and allowing it to die, because that is what happens when you ignore the problems. And so you have to think to yourself, when people hesitate and don't engage in those difficult conversations, there is a cost to not having that conversation. There's a cost to not speaking up and saying what you need. Um, and that's true again of yourself and with others. So if you're not sure of yourself, like how you're feeling about it, or others, don't be afraid to ask. It's better to have those conversations than to not really. I mean, I guess, unless the intent is to let the relationship die. So it's important to assert yourself. Clear communications boost your self-esteem and your decision-making skills. You want to express your thoughts and feelings and needs openly and honestly. You want to stand up for yourself while respecting others without being hostile or aggressive. And to improve your assertiveness, it's important to value yourself and your opinions. They are as important as anyone else's. And to know your needs and wants, and to learn how to say no. Know your limits and don't let others take advantage of you. When you're trying to effectively communicate, and you're listening to me say all this, and it's like, okay, you need to effectively communicate, and you need to learn how to assert yourself and so on and so forth if you don't already. And some people are good at doing it with the easy stuff, but then they shy or they avoid the harder stuff. And we're in those moments where we're getting forced into the harder stuff because of all these changes. So there's some simple pitfalls to communication, which I know are usually pretty obvious, but they're definitely worth restating because I see this happen over and over again with couples. You really want to avoid big conversations when emotions are high. If you're upset and you're wound up about something, it's really better to bring it down, to stop talking, say, you know what, let's pin this and we'll come back to this when we're ready to talk about it calmly, because it's better to do that than to say something that you regret because you can't take it back. You really want to be present when you need to engage in those serious conversations. And that means removing distractions. And that means cell phones, laptops, television, music, children, whatever those things are. When you really need to engage, you want to do it without those distractions. You really want to be fully present for the other person. And watch your body language. If you catch yourself, with your arms crossed, or you're looking down at the floor and you're avoiding eye contact, people can feel that, you're defensive, you're closed off. So, relax your arms, keep eye contact, and lean in. Let that other person know that you're there. It is a gift to give someone your full presence. And it's a gift to receive as well. And then if you're doing all these things and you're still, again, not finding that you're communicating well, this is a very old kind of couples counseling 101 trick. It's to get couples to say each other, okay, I just heard you say this. In other words, just literally reflect back, I heard you say this. And that makes me feel like this. And when you get to that makes me feel part, that's usually where you find that disconnect, and it helps to bring it to light. And then you can talk about that. Self-care. There's all this conversation around taking care of yourself as a couple and taking care of your emotional needs and your communication, because as Dr. Shobeiri just went through, there's a lot going on there. There's a lot to be talking about. There's a lot to make sure we're on the same page so we understand what's going on, so that we're coming at this conversation about re-engaging in our intimacy and re-engaging in our sex life as a couple, and we're on the same page and we're working out of the same playbook. There's that. And there's also the conversation about being kind to yourself and taking care of yourself and rebuilding yourself. And that's true of both partners in this couple. Both people need to have some sense of identity. And the best way to do that is engage in self-care activities. And we all know many self-care activities, like, make sure that you eat well and exercise regularly and take your breaks and take a breath about once an hour. Set a timer on your phone to just take a deep breath and relax for a minute, to engage in those activities that bring you joy. We know these things, and anyone can Google self-care and find lists of things to do. But the challenge with them is they often feel shaming. There's often this sense of, yeah, I know I should eat right. I know I need to exercise every day. And when you hear someone say it to you, it's almost like, yeah, I know, lady, I know. These conversations are not at all intended to make you feel bad. And then, like, this is just another thing to add to your to-do list, but this is simply a smorgasbord. And this is to bring awareness and give yourself permission to prioritize your health, to take care of your body and your sleep and your emotions. And the beauty of it is when you give that to yourself, it helps give permission to those around you to do the same thing. And if you find that, all of these things that I went through, if you find that you're still really struggling with how to effectively communicate, or you're really struggling with your sense of self, your sense of identity, if you're really struggling with, it's interesting to me, I get so many patients who are moms who give birth to their first child and they get this huge sense of, oh my gosh, all the stuff that I know I haven't dealt with within myself, I don't want to pass this on to my child. I get this with dads too. This stuff from my childhood, these things I do, I know I don't want to be a bad father. I don't want to be a bad parent, and I really need to get my stuff straight. Or I'm really struggling with motivation or mood or communication, or just even keeping my thoughts straight, even just getting through reading my emails. So if you find that you're really struggling and you're just not getting there, please seek help. And help can come in lots of different forms. Help can come in, actually, let me go to the next slide. You can reach out to your doctors. Obviously, a doctor like Dr. Shobeiri is fantastic to talk to about these things, but your OB/GYN, your general practitioner, a mental health care provider, a faith-based support person in some way, shape, or form, a trusted friend who tells you like it is, the ones who tell you like when you've got it and when you really don't got it. But find help. EAPs, lots of large companies have what's called employee assistance programs, and they'll often offer free counseling sessions. It's usually like 4 free sessions. And then if you need care beyond that, they'll help you find a provider in the community. At Inova, we do have behavioral health services, and we take insurance, and we offer telehealth and teletherapy. So that's there as well. And if you need other resources, you can look on the back of your insurance card and find support for mental health care, or look at Psychology Today. That's a good resource to find a mental health care practitioner in your area. But the first step, if you find that you're just really struggling and you're really stuck, is to just recognize you need help and figure out, okay, how am I going to start reaching out for it? And that's it. That's my presentation. Thank you for your time, and thank you for listening to me this evening. And we're going to move to questions.
Questions, yeah.